Allergic rhinitis,
also known as hay fever.
and as we know, itis means inflammation and rhin means nose, so it's the inflammation of the nasal mucosa, which is the inner layer of the nose, caused by an allergen such as pollen from plants, dust, mold, or flakes of skin from certain animals. It causes our immune system to react to an allergen as if it is harmful, which further classifies it into two phases. The sensitization phase, which occurs upon first or initial allergen exposure. Allergens or antigens are presented to the T cells by antigen presenting cells during the sensitization phase of type 1 hypersensitivity. T cells then signal for stimulation of B cells to produce IgE antibodies and only IgE antibodies, which bind to the Fc receptors on mast cells and basophils, which mediates immune response and inflammation. We also have the early phase, occurring within minutes of subsequent allergen exposure. The early phase consists of a rapid release of histamine and inflammatory mediators such as proteases, prostaglandins, kinins, leukotrienes, and neuropeptides. And I want to highlight about the inflammatory mediator leukotriene as we're going to talk about in a few minutes. This diagram summarizes all the phases and how does this allergy exactly happen and how are the symptoms associated with these phases. For example, all of these inflammatory mediators will cause vasodilation, which will cause congestion and pressure. For example, the mucus gland stimulation will increase the secretion, causing rhinorrhea, and as you see, many other symptoms correlated with these phases. Allergic rhinitis may be classified by the pattern of exposure to a triggering allergen, such as seasonal, for example, exposure to pollens, perennial year-round, for example, the exposure to dust mites, or episodic, which is environmental from exposures not normally encountered in the patient's environment, for example, visiting a home with pets, visiting a home that has a different climate, and so on. Allergic rhinitis can be classified as intermittent, where symptoms will be happening for less than 4 days per week or for less than 4 consecutive weeks, and persistent, where the symptoms will be happening for more than 4 days per week or for more than 4 consecutive weeks. And allergic rhinitis severity can be classified as being mild when symptoms are presented but are not interfering with the quality of life. For example, the patient is having normal sleep, no impairment of daily activities, no bothersome symptoms. And it might be classified as more severe when the symptoms are bad enough to interfere with the quality of life, such as abnormal sleep, impairment of daily activities, bothersome symptoms. And also we have factors that may lead to a more severe classification, which include the exacerbation of a coexisting asthma. And I wanted to highlight here about the coexisting asthma. As we mentioned before, that allergic rhinitis have a release of inflammatory mediator, which is the leukotriene. And as we know that in the pathology of asthma, we also have the leukotrienes, which play as an inflammatory mediator that causes inflammation in asthma. And that's why we give leukotriene receptor antagonist in treatment of asthma. So leukotriene, they are inflammatory mediators that exist in allergic rhinitis as well as in asthma. So there might be a correlation between asthma and allergic rhinitis, and that's why coexisting asthma might cause a more severe symptoms of allergic rhinitis. And also having a history of asthma might or even having a first degree relative that have asthma might increase the risk for having allergic rhinitis, as we're going to see later.
Last thing I want to note here is that the mild allergic rhinitis can be either persistent or intermittent, so it might be mild persistent or mild intermittent, as well as the moderate to severe, it can be severe intermittent or severe persistent.
Of course, we cannot treat any patient with rhinitis without diagnosis, so the doctor will have a patient history and physical examination to know the symptoms, and we're going, of course, to state the symptoms in a few minutes. So he will take the symptoms and he will differentiate between allergic rhinitis and different similar conditions such as common cold, which kind of have the same symptoms, so he must differentiate between them. And of course, he can carry the allergy testing, which include the skin prick test, where we place different allergens on the skin and we note the inflammation and the allergy that is happening on the skin, or we can do a blood test. And of course, the doctor will ask when are these symptoms happening? Are they seasonal? Is there specific triggers for them? Is there a pet that these symptoms happen upon in contact with, or others? And also, of course, he will ask about the chronic conditions and comorbidities, because as we said, there's many conditions that might cause a higher risk for allergic rhinitis, as well as we need to see if this patient is having any complication from the allergic rhinitis as well. So these conditions can increase your risk of developing hay fever or allergic rhinitis, having other allergies or asthma, having a condition called atopic dermatitis or eczema, which makes your skin irritated and itchy, having a family history such as a parent or sibling with allergies or asthma, living or working in an environment that constantly exposes you to allergens such as an animal dander or dust mites. Symptoms of allergic rhinitis might include nasal congestion, sneezing, rhinorrhea, which is usually clear in color, itching of the nose, eyes, palate, postnasal drip, frequent throat clearing, and sometimes it might be accompanied with cough. Now, sometimes and in chronic conditions, we might see something that is called allergic shingers. Now, what is these allergic shingers? As you might see in this picture, it is the swelling of the conjunctiva with darkness and puffiness of the lower eyelid, reflecting venous pooling of blood in the lid vessels under the eye due to the swelling of the tissue in the nasal cavities. In addition, chronic allergic rhinitis may lead to frequent rubbing of the nose and what is called allergic salute, and the development of an allergic crease across the nasal bridge, as you are seeing in the picture. In addition, when nasal congestion is presented from allergic rhinitis patient, and especially children, they might develop adenoid face, and that's because of chronic breathing from the mouth. Allergic rhinitis complications might include reduced quality of life, which can interfere with the enjoyment of daily activities. It might cause you to be less productive, and for many people, it may lead to missing work or school. In addition, poor sleep, it can keep you awake or make it hard to stay asleep, and this can lead to fatigue and general feeling of being unwell or malaise. Worsening of asthma, it can worsen the symptoms of asthma, such as coughing and wheezing. And it might cause sinusitis. Prolonged sinus congestion due to hay fever may increase your risk of getting sinusitis, which is an infection or inflammation of the membrane that lines the sinuses. Ear infection in children. Hay fever often is a factor in middle ear infection, which is usually referred to as otitis media. So how do we differentiate between allergic rhinitis and other similar conditions? So starting off with common cold or flu, how do we differentiate between allergic rhinitis and common cold or flu? Well, in allergic rhinitis, the symptoms are temporal and bilateral, whereas in common cold they are unilateral and they are not temporal. In addition, in allergic rhinitis, we do not have fevers or chills, we do not have headache, we do not have anosmia, which is the loss of smell, we do not have neither malaise nor body aches. In addition, in allergic rhinitis, the rhinorrhea is clear in color. However, in common cold, the rhinorrhea progresses. It will become clear, then purulent, then clear again. Moreover, in allergic rhinitis, we have repetitive sneezing, and in common cold, we might have sneezing. However, it's occasional and not repetitive. In allergic rhinitis, we have itchy eyes, nose, whereas in common cold, we do not have itching. Itching is not presented. In allergic rhinitis, the symptoms are worse upon awaking and in the evening, whereas in common cold, the symptoms are presented throughout the day. And in allergic rhinitis, we might see a more common symptoms such as the allergic salute, the allergic crease, allergic shingers, the adenoid faces, and also we might see a personal or family history of asthma, allergic rhinitis, or even atopic dermatitis. In addition, we need to make sure that there is no concomitant allergic asthma. Usually, in asthma, we will have a difficulty in breathing or disordered breathing. We will have cough, wheezing, exercise intolerance. So we must evaluate for asthma on every follow-up visit, particularly in children. And also, we might also perform spirometry whenever asthma is suspected. Also, how do we differentiate if we have a complication? For example, how do we differentiate allergic rhinitis from chronic rhinosinusitis? Usually, a In allergic rhinitis, we have a clear rhinorrhea and no facial pain, whereas in chronic rhinosinusitis, we might have a purulent rhinorrhea, and we might have as well facial pain. And usually when you tell the patient to bend down, he will be having increased facial pain, and that's how you know that he's having a chronic rhinosinusitis. And usually the duration of the symptoms will be short in term if it is a allergic rhinitis. However, it will persist more if it's an chronic rhinosinusitis. And also, how do we know that this patient doesn't have otitis, which is also a complication? There will be no ear pain, no otorrhea, which is a discharge from the ear, and there will be no fever as well. And also we need to make sure that is not a medication-associated side effect as well. This was all about allergic rhinitis, and in the next video I'm going to talk about the treatment, the non-pharmacological and the pharmacological. So make sure to subscribe and stay tuned.